Welcome to Adapt English. The best way to master growth and development is to focus on the key concept. You don't need to know every age group. The specific age group the NCLEX will ask you in nursery school. This video is designed to give you those information. The questions are straightforward because I'm focusing on the key concept. 10 questions. Keep track of your score and see how you go. Let's go. First question. What am I asking? 2-year-old, very important. Which developmental finding should the nurse expect? What do you expect? That's what the question may ask you. They may say so many things, but all they asking you, what should you expect? And nurse is assessing 2-month-old infant during a well-child visit. What do you think? 2 months. Bring your thinking, critical thinking, and say, what can the 2-month-old do? Roll from back to the abdomen. Put them on their back and they can roll to the abdomen. Can they do that? Social smile, present. Is this what you see in a 2-month-old? Use their pencil grab. Is this pencil grab? Is you basically find motor skills to be able to achieve that? Walk with assistant. A 2-month-old, can they walk? You see, you should not overthink the question. It is what it is I've given you. To roll from your back, if I put you in your back and you can flip, you need to have a head control. A 2-month-old does not. Therefore, this usually happens 4 to 6 months. Social smile is present in these kids. Pencil grab, it requires fine motor. If you can roll from front to back, there's no way you can have a pencil grab. We usually occur 9 to 10 months. And to walk, you got to have a pencil grab also. 12 months. You see, I know you got it. And I know you use that strategy. All the questions, think like that. Don't memorize, but pay attention to the key fact. And when you're answering the questions, you can use to eliminate the answers. This is the way to answer them. Same thing. Which finding require further evaluation? That means the kid is not doing what he's supposed to do. Rewrite the question on your own. And then it's assessing a 6-month-old infant. Think about what the 6-month-old would do. We saw a 2-month-old. Therefore, if I see something that is less than that, I'm not going to pick it. I should pick something higher. Now, roll from back to the abdomen, right? I give you that clue. I said they can roll. After 2 months, cannot do that. But 4 to 6 months, can roll from what? They are back to the abdomen. Do you need evaluation? Stop the video, answer your questions on your own, and keep track of your score. Can they sit with support? Think about it. Do they have a head control? And do they have babbling vowel sounds? The questions say, need further evaluation. Can they do that? A 6-month-old. Think about it. Of course, they can roll from back to the abdomen. Therefore, if they do that, no further evaluation. The kid sits with support because that's when they do. As they grow, after 6 months, they should sit unsupported. You should have achieved head control to be able to roll back and forth. 6 months, no head control, that's a problem. And of course, you can babble some words. That's okay. Mama, dada, it's okay. Which statement by the parent indicate understanding? That means now we're teaching the parent. And then she's teaching the parent about expected development of 9-month-old. We saw 2 months, we saw 6 months. You see the progression I'm taking you, 9-month-old. Therefore, if I see something, they saying something below 9 months, they don't know what they're doing. What do you think? My baby should be able to say 2 to what? 3 words. We saw 6 months babbling. Can they do that? My baby may develop stranger anxiety. What do you think? My baby should walk independently. What do you think? My baby should walk independently. What do you think? My baby will have what? Full bowel control. 9-month-old. Pick your answer. Let me know. Pick your answer. Let me know. My baby will have a full bowel control. There's no way. That's like a toddler doing this. My baby should walk independently. You have to be 12 months and above. At 6 to 12 months, you develop stranger anxiety, good understanding. My baby should be able to say 2 to what? 3 words. What do you think? That's 12 months. It's not ready yet. Therefore, this indicates correct understanding. And this is assessing a 12-month-old infant. Now we get to the 12 months. Which milestone is expected? Like I said, this video is to teach you. You see how I progressed? So if you have an issue with this question, go back to question 3. I'll build a tower of 6 blocks. I can walk independently. I will use scissors and I can ride a tricycle, right? What do you think? You have to build a tower, 6 blocks. That's too much for a 12-month-old. They're not ready. They don't even have an assistant to walk. Therefore, they can't build a tower. But they can work independently. They can walk independently with a little bit of assistance. Scissors require preschool. That's skill that require in the preschool age. And to ride a tricycle is a 3 years old. You can do that. Number 5. And this is assessing a toddler. Now we progress to a toddler. Which behavior is expected at the age of 2 years old? We finished with the 12 months. Now we have 2 years old. Which behavior should you expect? Do they involve in the parallel play? Do they involve what? In the corporate play? They have no interest in other children? Do they share their toys willingly? What do you think? What kind of play a 2 years old will involve? And what do they do? I can tell you, a younger age will involve what? Solitary. And after you move to solitary, what do? Do you go to what? Parallel, or you go to associate or cooperative? That's the key. You see, 1-year-old will do what? Less than 1 year infant will do solitary play. If they involve in solitary play, then as you progress and you are 2 years old, that means what? You can do parallel play. You can play alongside each other, but you stay on your own. You don't share your toy. As soon as you get older, get into preschool, you start doing what? Associate play, where you can share things, right? But there's no master. Then you go to corporate play when you get older. Therefore, this is what is expected. And this is a teaching parent of a 2-year-old. Which statement indicate understanding of language? You have to understand the language. They may ask you, class take 1. What do you think? My child will speak in 2-word phrase. Watch for it. There's difference between word and word phrase. My child should form full sentence. How can they do that? My child should say 50 plus word clearly, right? Clearly, with clarity. They can say 50 words, but he has to be clear. And my child should read simple books. Stop the video, pick your answer. A 2-year-old cannot read a simple books. That's not acceptable. They can have 50 words, but it may not be clear. And the child should have a form of full sentences that require 3 to 4 years old. So 2 words, 2 phrases is okay for 2-year-old. And this is assessing a 3-year-old child. Now look, 2-year-old can use 2-word phrase. A 3-year-old, what would they do? They cannot do 2-word phrase. You see, I'm trying to get you to think that's the progression. You got to watch this video multiple times. After you watch it, you can know I went through the progression to help you understand it so that you don't memorize. What is expected? 2-word phrase. If a 2-year-old can do 2-word phrase, a 3-year-old, you should give them a more advantage so that they can do more things, right? They can ride a bicycle. It's a 3-year-old. How can it be B and T, right? Tricycle, 3, no by. They can state their first name and the last name. More phrases, right? More advanced. And they cannot jump, right? What do you think? What do you think? At this stage, they can jump. So that's wrong. They can say their first and last name. You expect them to be using tricycle more than 2-word phrase. That's your answer. And this is assessing a 4-year-old. Which developmental milestone you should expect? Now we progress to a 4-year-old, something more advanced. Draw a stick figures with 2 parts. The word 2 means what? 2 parts. That's whenever they use the word 2, 3, 4, it's a clue telling you it's related to what? The age group. That's another way you can think about it. They can count to 10. They can use pencil grab. They can walk with what? Assistant. What do you think? A 4-year-old draw a sticky figure with 2 parts. That's a 2-year job. 2-year can do that. They can use pencil grab. Pencil grab get achieved 9 to 10 months. So they should already have it. Work with assistant. They shouldn't be working 12 months old, long time ago. 12 months they should be working. So why do they have to work with assistant? Count to 10. It's better. Number 9. And this is assessing the school age, advanced, 7-year-old. Is expected at what? What kind of thinking? Egocentric, separation anxiety, magical thinking, and concrete thinking. Think about all these things. You don't have to memorize. You can look at the answer choice. It will pop out like a candy. That's the way I believe. Popping out like a candy. Who is egocentric? I care about myself alone. That's a preschooler. Who is separation anxiety? Usually infant, right? 6 to 9 months. Magical thinking. It's also preschooler. A concrete thinker is going to be somebody who is older, school age group. And the last one, and this is assessing an adolescent, older patient, which findings suspected. What would they have to worry about? If you have an adolescent child, you know what they care about. I have one, and they very, very typical. You know what they care about. Concern about their body image, fear of strangers, parallel play, lack of abstract thinking. There's no adolescent who don't have abstract thinking. That should be telling you that's not true. Why would they have to do parallel play, playing along each other, not talking? They're always on their phone. Cooperative, right? Fear of strangers. There's no way. Therefore, you're concerned about their body image. 10 questions. Does that give you a perspective? This is not everything. If you need more content, check Adaptant Class. I will link a video on growth and development. Some of the milestone I did a crash course too that you can use to answer this kind of question. But this is to give you a framework that don't memorize, don't overwhelm yourself. Don't feel like you have to know everything. These little milestone, and then you put your head together and said, I got this. This is the best way. Take care of yourself. If this video helped you, click on the like button, share it with your friends, and subscribe to Adaptant Class for more content like that. Thank you very much.